Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Pain is one of the most common symptoms experienced by so many people in their lifetime. People commonly treat pain using painkillers such as Panadol, Brufen, diclofenac, or other different sorts of pain medicines. Did you know that there are other ways of controlling pain without the use of medications? Things like massage, nutrition and rehabilitation are other ways in which you can control pain. With me in the studio is our fitness and our pain relief expert, Mr. Sina Ismail, who is going to take us to discuss the ways in which one can control pain without the need of medication. You're welcome, Dr. Sina.
Good afternoon.
Sina deals with pain relief, nutrition rehabilitation, and exercises.
Yes.
The use of exercise all to control pain and make someone's well-being better.
Yes.
Okay.
That's correct.
Yes.
We use that because we know that pain, it tends to be temporary. So you know there's two types of pain. There's acute pain, which happens less than a month. And also, if the pain persists and you don't do anything about it, then it goes into chronic pain.
Okay.
So chronic pain tends to be more than 3 months.
Okay, and chronic pain tends to be the type of pain which gives people a lot of headache.
Yeah. So people become accustomed to it. So they think pain is normal. They just accept it.
They just accept to live with the pain.
Yeah.
I mean, they have taken so many painkillers,
Yes,
changed different doctors, but they still get these pains persisting.
Yes. So a number of my clients that come to me, they're already on painkillers. So some of them on a different 5 painkillers. So to eliminate the pain. So however, once you do assessment and you find out what they're taking and you start treating them, they come off the painkillers.
Okay.
And also people take painkillers thinking it's going to take away the pain. Painkiller is just, the word says painkiller. It does not take away the actual cause of the pain. So in a nutshell, so people have to know where to go. So it's not just about medication to take away the pain.
Okay. So you're highlighting a very important aspect, managing pain without the need of medications.
Yes.
I think that's a very important thing for people to know. You can control your pain, especially if you have the chronic types of pain, whether it is back pain or pain due to diabetes or due to even sometimes post-stroke, people can experience types of pain. So it is not just medications that are available to control pain. There are so many other methods that can be employed, such as the use of exercises or physio exercise or physiotherapy or nutrition rehabilitation. All these are ways in which you can attempt to relieve the pain and make the person feel better. So tell us about, so when you receive a patient, let's say a patient comes to you with this back pain that has been persisting for a long time. I think these are patients you have encountered so much.
I come across loads of those.
Okay.
So loads of people that come up with is back pain.
So how do you manage such patients?
So first and foremost, I do assessments. So I find out what's the cause of the pain, what kind of job they do. Most of them tend to be in the seated jobs. So if you look at the day-to-day running, they're in a job sitting down. They leave the job, they go to the car, they're sitting down. They go home, they're sitting down. So there's not a lot of exercise. And also, one of the things I find, people are less active. So they don't do any exercises.
Okay.
So when you're younger, you do loads of exercises. Yeah. But as time goes on, due to work and busy life schedule, family commitments, you tend to find that you're not doing any exercises. So therefore, that I find that's a very contributing factor towards the lower back pain.
Okay.
And always 90% of people that come to me, they've got a form of lack of exercise, not eating well, not sleeping well. So all these contribute. So once I find that, then I do the assessment, the actual palpation, find out the area that's causing pain.
Okay.
And also I look at a frame, how they're aligned, the body's aligned. And through looking at that, you find that what's compensating. So then when I find that, then I put them on the couch. Then I start process like working on those areas.
On those areas
Yeah.
which are giving the pain.
Yeah, so I use a little bit of massage technique, which is called sports therapy. It involves a little bit of pain that what people can handle. Then once we finish, then we do a lot of movement because the tissue in that area tend to be very hard. So it needs loosening up. So once the tissue is loosened up, then we do loads of mobility work. So the mobility work involves that moving those areas, you know, making sure the joints start moving, extending, and also making sure the muscles elongate. So that way it relieves the pain.
Okay.
And also other stuff that we can use stuff like TENS machines, which causes the vibration to relax the muscle.
TENS machines, what are these?
So these are the ones that you put, if you've seen, they put the pads on and they set electrical current. So you put it onto the body. A lot of physios have it. So this is what they use. So
they use an electric current to...
Yeah, exactly, to soften out those areas.
To stimulate the muscles and relax them.
Yes. So also we use ultrasound to help the tissue recover. I'm sure you heard of that.
Yes, there are some techniques which are, they use sound technology to help relax the muscles, and in a way it can relieve the pain. Okay.
And also other stuff that we use, we encourage clients or patients to use rice at the time. That means you should rest the place, ice the area, and also compression, and then you elevate the area so that you don't put any stress.
So an abbreviation called RICE.
Yes.
This is for any type of injury?
Yes, so when injuries first happen. So if you've got any pain that's happened now, what should you do immediately?
So it is a first aid immediately someone gets injured.
But also it can be used after treatment. So once we do the manipulation and also sports therapy technique on the area, the area tends to be sore. So when it's sore, you can use stuff like ice. Some people occasionally go into the area that you said you shouldn't use, stuff like ibuprofen, the
medications, yes.
But if you can't, try to minimize that. There's other simpler ways.
Yes, because some pain medications come with so many other complications, especially the brufens and the diclofenacs. They tend to be problematic. So if people can familiarize themselves with these are techniques which are, I think they're relatively simple and easy to do.
Yeah.
An abbreviation called RICE, meaning you rest the injured part.
Yes.
For the R, rest.
Yeah, you ice.
The I, meaning you put
ice.
ice or you cold something.
It's called ice, so you put ice on it. But the other thing in terms of icing is very important people to know. So I've had cases where people had to put naked ice on the skin. That shouldn't happen.
Okay.
So what people should do, they should put in a plastic bag, wrap it twice, and then put it on the area.
In a plastic bag or a piece of cloth?
Piece of cloth as well.
Okay.
But normally, again, you can buy other stuff that where you can put the ice back in and lock and put it on the area.
Okay.
So you can do that. But try to avoid putting naked ice on the skin. You're definitely going to get frostbite.
So avoid putting ice directly on the skin, wrap it in a cloth or a cavera or polythene bag, and then you can safely apply it to the injured area. So ice, the cooling effect is what reverses pain.
Yeah. So it stops the swelling as well.
Stops the swelling too. Then the C is the compression. How should one compress?
So you can either use the ice as well as a compression in that area. So you put pressure to that area to relieve that.
Okay.
So that's the compression.
So they can even tie the ice pack around the injury.
Yes and no. I've seen loads of the sports people tying ice. We've all seen that. It's not recommended. You want to apply pressure, which is a compression. So when you tie the ice here, let's say like on a knee, you're not applying pressure to reduce the swelling. It's just there. It's just
the ice around it.
So it's better to apply a compression.
Okay. And the final thing is the elevation for the E. Why is it that we have to elevate?
It's because, take an example, like if it's a knee again, you don't want to put pressure on it. So you want to
reduce the pressure.
So you want to reduce the pressure and also the pain. So elevation helps.
Okay.
And also sometimes elevation helps the drawing the blood back onto the area. So you have to remember when you put it up,
the blood flow
Yeah.
leaves the area much better.
yes,
Okay, so it can also remove some of the toxins and
that's
the
correct,
injured tissue elements. Okay, so remember, you can always send your questions to our social media platforms on Facebook and on Twitter. We are discussing physical fitness and well-being, in particular, how to manage pain without the need of medication such as Panadol or Brufen. Our expert in the studio, Mr. Sina, has just explained to us that techniques which are non-pharmacological, that means we don't use medicines, are also effective in controlling pain. Techniques such as rest in an injured place, putting an ice pack, compression or applying pressure on the place, as well as elevation, all can help to reduce the pain and promote injury.
You are watching the Doc Talk Show.